Welcome to the OptiBreathe Show, where we explore the world of breathing. I'm your host, Princess, and today we're going to talk about the connection between breathing and the pelvic floor, the crucial role breathing plays in all stages of pregnancy, and how specific breathing techniques can protect your pelvic floor during lifting and high-impact sports. Joining us is Maria Tumkin, a pelvic floor physiotherapist at Acumamas Wellness Clinic in Vancouver, Canada. Acumamas Wellness provides care for the full spectrum of fertility, pregnancy, and postpartum needs, ensuring you can access holistic support every step of the way. I would just like to take a moment to thank them for hosting me in this beautiful Olympic Village location, and I would like to thank Maria for making this episode possible on pelvic floor health. Her passion is to help people build a strong mind-body connection, much like breathing does. Maria, we met at the wellness show.
Yeah.
And even in our short conversation, I could see the passion around breathing and the pelvic floor, the connection between the two.
I felt the same. I felt the same about you. So I feel like we clicked really well. So I'm very happy to have you at Acumamas Wellness and that we get to have a talk. And I'm very excited to learn more about breathing as well from you and how it all interconnects to the pelvic floor.
Yeah, let's just start off by letting our audience know a little bit more about you and your role as a pelvic floor physiotherapist.
I'll do a little bit of a debrief in terms of how I even got into pelvic floor health. As a child, I was always into sports. I started with gymnastics, then I was doing track and field competitively, and after that, I just stayed in the strength training, running. Kind of fields. I then did some triathlons and half marathon runs. So I got to experience the body in many different ways. And that's how I got into a bit more how the breath is affecting the body. So I'm an experimenter. So I like to, whatever I do on my own, I want to bring that to the people I work with as well. And so choosing a career path was, well, I'll go into kinesiology as an undergrad, then go into physiotherapy where I started. So it was like all about movement. Started working at a hospital where I was seeing individuals that were experiencing incontinence that was really affecting their time at the hospital, even though they were not coming in incontinent to the hospital. I'm like, why is that even happening? Like, that should not be a thing. So I ended up taking a pelvic floor course initially, thinking that I'll be working in that hospital setting, but then just opened up my eyes to this whole other world of the pelvic floor and how it interconnects with women and their menstrual cycle, as well as how they're going through life in their perimenopause and menopausal time. So this kind of how it led me to the pelvic floor world. And then through that experimentation and my expertise in movement and like having interest in how the breath work is interconnected with the pelvic floor, I started connecting the dots and then building that connection. It's like if I'm interconnected with my body over time, didn't always have that, even though I was in sports, I feel like everybody should have that awareness and know what's going on with their body rather than the body is giving you signals if something is wrong and you don't know what to do with it. Like that's just not great. So that's where I come in, is to be that educator and supporter for people so they can take their health into their own hands and have the tools that they need to take care of themselves.
And I still think that there is a lack of conversation and education surrounding the pelvic floor health um, because of the feelings of embarrassment. Like you said, incontinence and so forth. It's such a taboo topic. Everybody has a pelvic floor. What is it exactly? I see that your model is right here.
I carry it with me everywhere. It goes to all places. And it's a group of muscles and it has multiple layers. We have what you see on the outside is that what everybody can see. And then we have a group of muscles on the inside. So you can see that we have the organs kind of lined up in like bowling lanes, if you may, and that's there on purpose. So the pelvic floor muscle work as a sling to support the pelvic organs. We have the bladder at the front, then we have the uterus behind it, and we have the rectum at the back. So it's already a busy place. And in addition to supporting those organs, the muscles work to maintain continence. So making sure that pee doesn't come out if you are coughing, sneezing, if you are running, walking, if you're picking up groceries or picking up a sofa because you have to move it out of the way. So the muscles are working on a guide, so on a gauge rather.
Okay.
So when you're resting and you're sleeping, they don't have to work as hard because you're in a horizontal position, less gravitational forces are acting on it. And then if you're getting up from that position, the muscles need to work a little bit harder. You're coughing, that gauge goes up. And then if you're running or jumping, again, they have to work even more, right? But they should work going and working very hard and then resting as well. So they do have a range of motion that needs to move.
Okay.
And so in addition to that, they also need to relax. So if you need to pee, have a bowel movement, pass gas, go through labor, the muscles need to be able to open up and relax to allow things to come out as well. So as like any other muscle, they contract and they also relax. They support our pelvic organs. They're also quite special due to their very close support with the nervous system and the vagus nerve. So they're quite reactive to what's happening to you day to day. So if you're stressed out, the muscles may tense up like other parts of our bodies. With that interconnection and other nervous system innervation to the pelvic floor, they are also responsible for pleasure during intercourse as well. So they have many, many different functions, and they're also interconnected with the diaphragm. So how do they even work together? So that's where I call it the core unit system. So if we have the pelvis at the bottom and the diaphragm is a dome shape, so when I'm taking a breath in, that dome should descend down and flatten. That creates an abdominal pressure. So to accommodate for it, the abdominal wall expands, and then the pelvic floors actually lengthen and go down. When you breathe it out, even just passively, the dome comes up, and then that changes the pressure in the abdominal cavity. Then the pelvic floors kind of shorten and lift up. So if we're breathing 20,000 times a day, the pelvic floor muscles also move with the diaphragm.
Okay.
So in a healthy system, as this is moving up and down, my pelvic floor muscles also move up and down. And so then that creates this whole unit system that we're looking at. And the pelvic floor muscles are a little bit stupid, I call them, because they are not really in charge of when they're contracting or when they're relaxing. A lot of that really is affected by how the diaphragm is moving or the nervous system around it.
Okay.
And so if we're having an issue, let's say with the diaphragm, or we're not expanding our abdominal cavity and getting the air really down into our lower lobes of our lungs, our pelvic floor muscles may get stuck in a shortened position. That can lead to other issues.
Okay. And talking about other issues, like every time I hear about the pelvic floor, it's always the negative aspects of it. What are the benefits of having a healthy pelvic floor?
Mm. And so having a healthy pelvic floor, then there's no potential leaking, whether it happens with impact like coughing and sneezing, or running and jumping, or maybe there's like an urgency. So this behavior pattern where the bladder is just spasming, or there's like triggers of like running water, and then there's like a really strong urge to go to the bathroom. So then leaking can occur. Or there's like mismanagement of the pressure in the abdominal wall, or pain or discomfort with intercourse, or pain or discomfort around the pelvic area. So those would be signs and symptoms that the pelvic floor muscles are not doing what they're supposed to be doing, right?
Yeah.
So if then a healthy pelvic floor is when we're not experiencing leaking, it's moving appropriately with the diaphragm, there's no discomfort with intercourse, we have good libido during intercourse, it feels pleasurable, that is a thriving, healthy pelvic floor. And it's interconnected with our hormones as well, and for women more so, with menstrual cycle. So if hormonal levels are not in balance, so then the tissue in the pelvic floor may feel like more frictiony or just not as hydrated. So that can also play a role into maybe we need to address that to make sure that the pelvic floor muscle is healthy because it has its own microbiome. just like our gut does, or our the mucosal lining of our nose and like our mouth as well.
Well, apparently, lungs also have a microbiome. Like from what I've heard, someone was doing an experiment on a pill. They were producing this pill for the stomach, and they were saying they were gonna start to experiment with puffers for microbiome in the lungs. So that's yes, I think microbiome is everywhere, and it's still an area that needs to be explored.
Agreed, agreed. Yeah. So same thing with the pelvic floor muscles and the vaginal region. There is a thriving microbiome. So if imagine if we're a person experience lots of urinary tract infections or yeast infections, so that can be an indicator that maybe something is going on in the pelvic floor area. Maybe, sometimes a pelvic floor physio is the first line of, maybe we need to go see someone and explore what's going on with your hormones and the pelvic floor microbiome.
So there's a lot of communication happening in the pelvic floor area that I mean, I don't even know about. But you did say that, the pelvic floor is kind of stupid, and it's kind of controlled with the diaphragm or things happening in the brain, the vagus nerve. How do we know if is this something that we have to think about if they are moving in tandem with each other? Like if I breathe in, you said, the pelvic floor goes down. Will I actually feel that? And if I don't, is it something that I need to think about and consciously do?
That's a great question. I get that question a lot. Because the pelvic floor muscles, they work day in and day out, we don't need to constantly think about them, but reconnecting to this area and building that awareness so you know what it feels like for the muscles to descend down or to contract can be helpful for you to then notice, are there any changes that are happening, right? So let's say you've built up that awareness of the muscles can lengthen with your breath in, they kind of lift up when you breathe out. You know what it feels like to contract them, you know what it feels like to relax them. That's going to be helpful with some of your like daily habits, like having a bowel movement. Like some people strain when they do that, right? And that can lead to pressure on your pelvic floor. So how are you straining or how are you pushing to have a bowel movement? If they're a pressure mismatch, they may develop hemorrhoids, and that is an issue in the pelvic floor due to that mismatch of pressure. Or maybe if they want to go through labor, but then they're contracting, right? They tell you to push and you're like doing like a Valsalva move. That's going to constrict the pelvic floor versus
Relaxing it.
correct. So you're right, like there's different types of like breath work, and that will affect how your pelvic floor muscles react to that breath, whether I'm just going to do like this bracing movement versus I'm like, okay, I'm bearing down, but without putting pressure on the pelvic floor.
Okay.
Same thing with like jumping and running. It's very difficult for us to actually feel the pelvic floor
To feel the
muscles.
sensation. Okay.
Correct.
Okay.
But even with the run, can we, like do a contraction and release to just get the hang of it? Sometimes we incorporate that, but usually I'm more of a proponent of like the body mechanics and the breath. So no breath holding, so then that muscle can do what it's supposed to be doing. So we don't want to think about it 24/7. We do want to build that awareness of it, so you know different scenarios of what it should do, and then we apply different habits and different patterns that the person uses through their life. So then we can hopefully change it if they do experience an issue with it. And if they don't, then great. Now you have awareness of your pelvic floor because it will go through changes as we age,
Yes.
right? Hormonal changes, then the tissues will become more
Less
lengthened. Correct.
elasticity, like everything
Yeah.
in our body.
Yeah, and then sometimes symptoms will reemerge or they will start happening around 50 and 60 because of those changes. So then I see women at that point be like, I started leaking out of nowhere. It never happened to me before. And so then we go back and do that re-education of the body, that awareness. If we need to strengthen, we do. If we need to work on releasing the tension, we do that. It's not always just doing pelvic floor exercises is going to fix the problem. No, we want to make it more functional to their lives.
From my understanding, then, the sensation of the pelvic floor muscles contracting and relaxing is not something that we are going to feel as we're just casually walking, but it's something that we want to be aware of because when we're doing things like lifting or running or just lifting a chair, for example, um, then if we are like pushing and holding our breath, then we know, oh, there's the pelvic floor muscles, right?
Yes. Yeah.
Okay.
Yeah. Um, to add to it, sometimes there can be an organ prolapse, whether it had occurred through labor and delivery or due to that lengthening of the tissue during like perimenopause and menopausal time. So the pelvic organs can sink down lower into the vaginal opening. That's when women will describe it as a pressure or a presence or like a tennis ball is stuck in their vaginal area and they will feel it. So they will 100% feel it when they're
Like all
running.
day, every day kind of thing?
Yeah,
Okay.
it just really turns on all the like the signals of like, hey, I'm here. And if they are coughing or they're lifting something, they will be so much more aware of that area. That is when the like the nervous system is very sensitive, but then also it's just a bit of a disruption of where the pelvic organ would be. It doesn't happen like overnight, it just happens over time. A lot of the time, if there's also a bowel issue happening, let's say a person is constipated, they have a lot of stress in their life, so their nervous system is already heightened up, they're going to be so much more aware of their pelvic floor and just the symptoms that are occurring there. They will manifest in pressure or pain and discomfort. So if we regulate that and work on some support, the prolapse is likely going to still be there. So it's not like we can reverse some of it. To a certain degree, maybe we can, but if the ligaments have lengthened, ain't no way. It's similar to if we sprained our ankle, there's always going to be some instability because of the lengthening of the ligament itself. We can build stability in like
Other muscles around it.
correct.
Yeah.
Yeah. We can do the same thing with the pelvic floor. And then working on the nervous system, then we're minimizing that constant awareness of the prolapse, and then the person doesn't feel it as much. Sometimes it will reemerge if you're more stressed out,
Okay.
right? So then having that awareness again is going to help the person to kind of manage what's going on with their life.
So prevention is much more beneficial than actually just taking care of something that when you feel it, it's like, oh, yeah, let me go and get that
Yeah.
looked at because now I can feel it. Okay. And so, since everything is kind of internally, how do you assess the pelvic floor muscles? And what is your approach to resolving and preventing pelvic floor dysfunctions?
Good question. In terms of assessments, I do look at the body as a whole. So I do a full head to toe assessment, looking where is their head position, where are their shoulders, how are they breathing, how is their abdominal wall firing, how are their glutes firing, how is their pelvis, hips and feet, what's going on outside. That's going to give us a good indicator if there's something that we need to address from like a structural perspective that could affect the pelvic floor. We look into the breath even more in different positions, whether they're standing, doing a squat, a lunge, standing up on one leg, just how are they breathing if they're lying down at rest. Like that gives me already an idea as to what may be happening with the pelvic floor. So really, I do the pelvic floor assessment last. It's not the first thing that I jump on. I look at other things because that's going to paint me a much better picture of what's happening with the body. For a pelvic floor assessment, we have options. We can do just like an awareness. So I'm guiding the person, feeling the different, like, let's say the pubic bone, the sit bones, the tailbone at the back, like with their mind. So building their awareness. We connect those dots as a like a diamond or a triangle. No, that's more of a diamond
Yeah,
than a
yeah.
triangle shape, feeling the different openings as well. And then we work on, can you like either squeeze those areas? What does that feel like to them? So especially for individuals that are apprehensive about having an internal exam, we don't need to do that if we can build that awareness because it's a similar way, then they'll be more confident that they're doing a pelvic floor squeeze correctly,
Okay.
right?
And how do you describe like what they're feeling is right?
I wait for their response.
Okay.
So if I tell someone to squeeze, I ask, what does that feel like? Are you feeling like you're just squeezing the orifices on the outside? Does it feel like I'm just squeezing like the vaginal area or the anus or my bum muscles or my urethral area? And are you feeling like there's like a lifting going upwards due to the shape of the muscles? If I take my fruits out of the way. The muscles are round. So when they contract, they will come together and then create this lifting,
Okay.
right? So if they're feeling that they're doing that, you're doing it correctly. If they're having a hard time feeling it, we'll get them in different positions. So in sitting right now, if you were to squeeze that area, you would likely feel it more at the tailbone and the anus. If you're leaning more forwards, you'll feel it more at the front. So that's our way of isolating the muscles rather than you can just contract the muscles around your urethra or your vaginal opening or your anus. I'm like, well, they kind of work together. So we do that type of
So put
awareness
them in
piece.
different positions.
Yeah, so they get a hang of it. So I do that for individuals that are not feeling comfortable with an internal exam. We have an option of like using a mirror and seeing, is this area moving as you're doing the squeezing? That's a good indicator for us too. Or if they wanted to do that at home, and we do internal exams. So I don't use any tools. I use just gloved fingers. I do the exam often with one finger, sometimes two, depending on comfort levels. And so then we can feel the tissue on the inside. We then do those pelvic floor squeezes. So now they have this external source that they can have that as a guide in terms of are they squeezing it correctly or not and what happens to it. I also assess coughing. So can you cough? And what the muscles are doing? Yeah. Are they like, is there like a pressure downward? So I do observe what's happening to the abdomen, or the muscles engage automatically or not. And then what happens if you're taking a breath in and breath out? Can I feel that subtle movement? And so with that, I will interconnect that with the client of like, okay, can you feel some of that? What's happening to those muscles as you're breathing in and out? Then we will engage the pelvic floor too on the breath out, just to get that hang of the range of motion.
Okay.
And for some people, I will also do a standing assessment. So if they're feeling prolapse or they're leaking when they're running, jumping, we're doing a standing assessment. A lying assessment is not going to tell me a whole lot about your pelvic floor when you're leaking and standing, because everything might feel different in that position. So then we do that as well.
Oh,
Yes. So a bit of versatility
yeah.
in terms of the approach of assessment.
It's a very detailed assessment.
Yes, yes, it really is. But it really helps to paint a picture as to where the problem is coming from. So that's going to help me fix the concern that the person is coming in with. So as an example, if it's leaking with coughing and let's say jumping, I want to assess their jumping and see them physically jumping. Being in like a starting position, let's say if they're doing squat jumps, look, so we're going to do a squat. Or if we're doing jumping jacks, let's do jumping jacks and break that down so I can see what their body is doing and assess their pelvic floor in that standing position. So standing up on one leg, what happens when you squat? What happens if we do a little bit of jumping? Am I noticing like changes? Can we re-engage the pelvic floor? And what does the diaphragm and the core is doing with all of it?
Okay.
Yeah. So then it becomes very individualized in terms of what we are addressing, but I want to have a nice whole overall picture as to what is happening and also have a good history in a sense of your journey through life, but then also more recent that started those symptoms, and then putting all of that together, then we come up with a treatment plan or exercises, again, being very mindful of people's time and what we can incorporate into their day, or into activities that they are already doing, or tweaking some of their stuff. Like if you're going to yoga, let's work on your breath expansion and awareness and your pelvic floor exercises in different positions. So you're not just doing, random squeezes. And so that way it's a bit more intentional. And then you have that time for mind and body connection. The rest of the day, let them do their thing. But then it's just that mindful piece, or maybe when they're doing Shavasana, like that's a great time for you to reconnect to your breath or reconnect to your pelvic floor. So it's like I'm adding exercise, but I'm adding it to an activity that they are already doing. And then that will turn into this pattern, consistent thing for them to start building that body awareness.
And plus, it's the right mechanics in the first place, right? Yoga is the best place to do that.
Yes, absolutely.
And I know you've mentioned about breath holding, but there are also other dysfunctional breathing patterns or breathing habits that people do.
Yes.
What are some of the common ones that you see that affect the pelvic floor?
A bit of like reverse breathing. So if you ask someone to take a breath in, they do one
Just
of
set the
this,
stomach in.
yeah, which will then shorten your pelvic floor on the inhale. And then when they breathe out, everything just collapses down. So that's a common pattern I see. And apical breathing. So what I mean is using their upper chest and their neck muscles to breathe. Just me observing them, how they're breathing, and with a deep breath, again, that expansion and activation of the neck muscles.
Okay.
That's what I often see. Breath holding is very, very common with exercise, whether with core exercises, if we're assessing how their muscles are working, they constantly hold their breath. Same thing with squatting, lunges, jumping. That's very, yeah, very typical.
Hmm. And so when they do these type of breathing habits or patterns, they're losing that intra-abdominal pressure, which then affects the pelvic floor.
Yes, yeah. And over
Okay.
time, they may have started those patterns very early on in their early days and then just stayed with them. And then as the tissue and our bodies change, then the body gets to a point where I'm done. Here are some symptoms for you. So it doesn't happen like out of nowhere. Pregnancy is more of a special type of it's not special, but well, yes, it is very
Yes.
special as to what the body goes through, but different in a sense of due to the body changes that are happening over 9 months. It's a lot.
Yeah.
People don't really appreciate it. And that's when symptoms can start happening, which makes sense. The body needs time to adapt. Then you go through that labor, and then you have to find this new functional way of being. And the body is not very smart at changing how it was before or to this functional structure that supports you without having symptoms. It will stay in certain positions. So, i.e., a flared rib cage and a forward pelvis tilt. So common. Like I see that a lot. And then that is quite reinforced through whatever activities they're doing or not doing. And you can still see it at 50, 60, 70, and 80. So if we address that, that often really helps the muscles in the pelvic floor to maintain continence, if that's the symptom that they're experiencing, or allow the muscles to figure themselves out and work as they should. Yeah.
Okay.
So if we can catch that earlier, that's great. And then we help to maintain that good balance of the body. So then the muscles in the pelvic floor can do what they're supposed to be doing.
Yeah,
Yeah.
at proper alignment.
Correct.
So we talked about all the common breathing patterns and habits that can cause issues with the pelvic floor.
hmm
What is the most optimal way of breathing for a healthy pelvic floor?
So yeah, so diaphragmatic breathing with the 360 expansion of the rib cage. With that too, then the pelvis also needs to be stacked with the diaphragm, right? So if the pelvis is too far forward, but then we're doing the diaphragmatic breath, the pelvic floor muscle will still have a bit of a harder time to work in that lengthened, shortened position with the diaphragm. So if we can have a stacked pelvis with the rib cage, with the diaphragmatic breathing, that would be an optimal way for the pelvic floor to work their best.
And I usually teach people to do diaphragmatic breathing when they're in the lying position
Mm-hmm.
at first,
Mm-hmm.
because it is the easiest way to learn how to do that 360 expansion.
Yes.
And I know that you said in the lying position, the pelvic floor muscles are relaxed.
Mm-hmm.
Can they still practice that and have it be an effective way to
Mm-hmm.
work with the diaphragm and the pelvic floor at the same time?
Yep, absolutely. I like you start in a lying down position because, again, less gravitational forces acting on it. We do trial also sitting and standing just to bring that awareness back to the body since it is harder in those positions. We incorporate mobility exercises for the rib cage breathing. I find that the back often is very stiff, so we have less of that back diaphragmatic expansion, a lot of belly expansion, especially individuals that have done yoga, so they do have some body awareness, some fair expansion through the rib cage outwards. Back is often just like a missing link. So I tend to harp on that and get people into different positions, incorporating, like, let's say a child's pose, but with back breathing, or maybe into a bit of like hands on the wall side bend with back breathing. So just to get more expansion, in addition to the diaphragmatic breath, progressing to sitting, standing, and other activities that they're doing. So can we incorporate it into a plank? Can we incorporate it into like a squat or something else that they're doing to then really help to strengthen and solidify that pattern so it turns into their day-to-day breath habit.
Okay.
Hmm.
Acumamas Wellness.
Hmm.
It provides, comprehensive care across pregnancy, across labor and delivery. So I want to talk about the crucial role that breathing plays into all these stages.
Hmm.
I've actually read from their website that according to the Urogynecology Journal, 50% of women experience pelvic floor dysfunction through pregnancy and childbirth. Can you explain? I know you did touch a little bit upon the changes in a woman's body through pregnancy, but can you explain a little bit more and expand on that?
Yeah, and so with pregnancy, you're right, we did touch on that, that the body changes. So what tends to happen as baby is growing in the uterus. Oh, so over in here, it tends to expand. Now that's going to squish your colon and like your intestines that are at the back. That's going to squish them to different areas. And same thing with the bladder. So bladder is also going to get squished to a corner. So because the area is already busy and it doesn't have a whole lot of space. So if we're adding a baby that is also a weight with the placenta and the fluid, etc., that's a big pressure on the pelvic floor, right? So if the muscles are working on a gauge, now we have extra pressure on it constantly.
Okay.
Then we are adding the structural changes to accommodate for the growth of the baby. So baby is going forwards, depending on the structure of the person. Some people have more wider torsos. Maybe they have longer torsos. That will then depend where their baby is going to go.
Hmm.
So usually then the belly is going to go forwards to accommodate. Then the pelvis needs to shift forward. Rib cage needs to lift up. Shoulders will round. Head will go forward.
Okay.
That's a very typical pregnancy posture. That alone, plus the pressure, often contributes to the pelvic floor symptoms. And with all of that, then we are trying to find a more of like an optimal position or reposition their body to a more optimal way. So maybe tilting the pelvis more back and bringing the rib cage down to minimize some of the symptoms. Also, the muscles, because they're under a lot of pressure, are they just tightening or they are just not very strong enough to support that extra pressure? So we need to work to strengthen them. Or is it because the diaphragm is getting squished and we're not getting enough breaths in to get the diaphragm pumping and getting the pelvic floor range of motion? So there's different scenarios that can occur as to why the symptoms are emerging, but due to the pressure and the body changes, those are the main contributors to the like symptoms that a woman can experience during pregnancy. So then we try to optimize it to the best way that we can,
Hmm.
so then someone does not experience those symptoms.
And with all the pressure, from everything shifting and moving and posture, can breath control during, prepartum help with that strain?
Yeah.
Okay.
Absolutely. So same, it's like let's reconnect to the diaphragm, let's connect that to the pelvic floor, and then find a more of an optimal place for the body to be from a structural perspective. So then it will be easier for the diaphragm and the pelvic floor to work together.
Okay.
Right. Usually in this position, in the flared rib cage, then it's not an optimal position for the muscles to engage.
Hmm.
So if we can shift that and also get that breath going, often people find a very good relief for their symptoms.
That's
Mhm.
good to know.
Yeah,
Because,
yeah.
all I think about when I think about breathing and pregnancy is during labor. right? Because they,
Mhm. Mhm.
you always see it in the movies where they're like, okay, like breathe, 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 right? And you never hear about the prepartum or postpartum aspect of breathing, but it does place an importance for the preparation, especially prepartum, the preparation for labor. Are there certain breathing techniques or strategies during labor that you teach here in Acumamas Wellness?
Yeah, absolutely. So I like when I get to see women during their pregnancy because now they have this like breath, pelvic floor awareness and baseline. So you have that baseline in terms of what it feels like to expand your rib cage and move your pelvic floor. So then you can utilize some of those strategies for labor and delivery and to help you reconnect with your body postpartum due to the lengthening that occurs. So let's run through that together. So now that they've got that awareness of their diaphragm and when you breathe in, the pelvic floor open and relax or just lengthen. And then when you breathe out, they come up. So that's the pattern that your body functions day in and day out. During labor, we want to keep so let's say we're breaking it down to early labor and active labor to push baby out. During early labor, we want to stay in that calm state, right? So to help to stimulate the vagus nerve, which is going to keep the pelvic floor muscles relaxed. So deep diaphragmatic breaths, long inhales, exhales will go a long way to keep the nervous system in that parasympathetic state or feel safe. When the body feels safe, it's easier for a woman to be, I call it the trance-like state, when the hormones to prepare the body for pushing are being elevated. So the endorphins, oxytocin, all elevate naturally to help to minimize pain. So the breathing is going to help to work through the contractions, allow for the body to feel safe to dilate to appropriate level to push baby out. So that's kind of what we work on during early labor. So they already have that baseline of doing the breathing. We just chat about some strategies around the preparation with continuing with those deep breaths. And so if a contraction is happening, instead of holding the breath, then can we breathe through it so we're not creating tension in the body? Then, because they have pelvic floor awareness, they also have that awareness. Oh, yeah, my muscles are clenching. I need to release them. So that is also helpful. If we're going into active labor, that is when the vaginal wall is dilating, the pelvic floor, we want to keep them open as much as we can. The uterus is doing a lot of the contraction. We are trying to utilize gravity and our abdominal wall, especially our diaphragm, since it's part of the core system, to then help baby out. So that's where we will want to keep the pelvic floor open, both on the breath in and the breath out. Utilizing that inhale to keep the pelvic floor open, and then exhale with flow tone noises and voices like moo, ooh, or grunting, that actually keeps the muscles more open. So that way that helps instead of contracting them or there will be tensioning because there's discomfort and pain happening. We're trying to utilize the breath and that awareness of the pelvic floor to keep them open during active labor. So then we're channeling the energy down into the pelvic floor rather than constricting. So it becomes a bit more mindful for the person. Now, sometimes they may need to hold their breath to push, but it's different if I'm bracing, right? If I'm doing this, like if you would in boxing, that would constrict the pelvic floor. We're trying to, okay, I create pressure and I hold my breath to push, but I'm keeping my muscle more open. So those strategies we work on during labor and delivery. So whenever I ask women that have gone through labor after we've done birth work, what was the most like helpful thing that you've learned? It's always the breathing. It's always the breathing for them to understand of, okay, I can keep my muscles open on the breath in and the breath out and use that to help with labor.
Okay. So before they go into labor, they're going to do diaphragmatic breathing, nice, slow, easy breaths
Mm-hmm. Mm-hmm.
to calm their system down, to relax everything, to help manage with pain. And then during active labor, they can bear down, but they will try to keep everything open with the breath in and with the breath out. And on the breath out, can be a little bit more vocal.
Yes.
Okay.
Yes, that's and for sometimes I would even suggest people practice that when they're having a bowel movement from the mechanism of the muscles opening up to evacuate or something for something to come out, using your breath instead of pushing or just bearing down on the pelvic floor. So using the breath, you'll be like, oh, well, things are just like moving along because I'm using my diaphragm. So it's like acts like a piston of pushing something down and even doing that low tone noise like it
That's
just
what I was laughing at.
yeah,
It's like imagine just somebody doing that in the
yeah,
bathroom and you're in the other room.
yeah,
You're like, what are you doing?
yeah. But it's a good way to practice. Otherwise, most people will not incorporate that into their day of practicing, and they think, "Oh, once I'm in labor, I'll be able to do it." I'm like, probably not. It
Yeah.
should be a pattern and a habit, so then you can tap into it
Yeah.
during the actual
Labor.
event.
Yeah.
Yeah.
How far ahead would you ask people to start practicing certain breathing strategies before they go into labor?
hmm Good question. I get people either they come in their first or second trimester. More often, it's second trimester, just because the body is going through more changes and they may experience some symptoms, not necessarily always pelvic floor, but maybe their hips or their back or their shoulders are bothering them. So then we'll add in the pelvic floor piece. That is when I often start integrating the breath work. At least your foundational diaphragmatic and I call it like the core breath of using the diaphragm and connecting to the pelvic floor. We start out at that point. Then leading into third trimester in preparation for labor, that's when we work on those breathing of having awareness of breathing in, breathing out, keeping the pelvic floor open. At that point, the person already has that awareness because they're connecting to the pelvic floor, then it's easy for them to integrate that type of breathing. So then they go into labor with that strategy of breath work. Then postpartum, I get them to start using their diaphragm and doing those breaths like pretty much like day one
Right
after labor.
away.
Yeah,
Okay. And it's safe too.
it's safe to, right? Because we're breathing. So why can't we also start activating the pelvic floor? If there were some like if there was a traumatic birth or
What about tears?
yeah, if there's a third, fourth degree tears or episiotomy, I would give, let's say, pelvic floor activation a little bit more time for healing. But the breathing, we can start pretty much right away of like, can we expand the diaphragm? Can we breathe all the air out and start? The muscles in the abdomen have lengthened. So now we want to start bringing them to a functional place. And nobody stops lifting a baby up. So baby is a weight. And
Yes.
so how is it that we can't do pelvic floor squeezes?
When we have to lift our baby and,
Yeah.
carry them
Yeah,
throughout
that's
the
my
day.
point. And it's like you're lifting and carrying them around, not just like, oh, just one lift and like constantly. And no one seems to think about that, whether there's a C-section or a vaginal delivery. So I'm like, well, we can start incorporating breathing and working on that alignment right away. So people that do and start doing those type of exercises and a bit of mobility and walking, their body comes back to a functional place a lot quicker than someone who does not. That's just something that I see through practice. So I'm noticing that if we can integrate exercise and like activations of the abdominal wall with some gentle exercises in the first 6 weeks, at 6 weeks, they're so much more connected to their body that it's a lot easier for them to integrate into other activities that they want to do, and then also not have any pelvic floor symptoms and also other symptoms around their body. So I find people, even though they've had like pelvic floor symptoms during pregnancy, but we worked on it, that improved with our adjustments. A lot of the times they don't experience symptoms post.
Wow.
Yeah, yeah.
So it's a big difference.
Yes, yes, yeah.
And we're talking about incorporating things postpartum.
Mhm.
Um, I do have a question. I know you have your certification in, what is it, pregnancy athleticism?
Yes, strength.
Yeah.
Yeah.
And so a lot of women that I see on the internet, a lot of women that I see in the gym that are pregnant, sometimes I look at that weight and I'm like, oh my gosh, they're pushing a lot of weight on top of the pressure with the baby in there. Of course, if they do proper breathing mechanics while they're lifting weights, it should be fine. But what is the cut point for how heavy they can lift prepartum, during pregnancy, and postpartum?
Good question. It would depend on their athletic abilities, where they're coming in into their pregnancy. So if we're looking at a woman that's been lifting weights or doing like powerlifting, or heavy lifting, during pregnancy, as her body adjusts, she maybe initially will be able to lift those heavy weights. Usually, as baby continues to grow, they're likely going to drop those weights just because it becomes not optimal, from a sense due to the body changes, and it's harder to lift those weights compared to someone who have never lifted before. Now, I'm a big proponent of exercise and weightlifting in pregnancy, just due to the fact that baby is going to be a weight after, and it's like 5 to 10 pounds at first, but that's going to be like 2025. If someone have never lifted that, that's a lot like load that will really affect their structure post. So can we start lifting like lighter weights early on to then prepare the body for labor? So the biggest way to prepare the body is actually staying active and modifying the exercises as they're progressing through pregnancy. So when you're seeing someone who is doing some like cleans and like really heavy lifting, they also have that body awareness and better mechanics of withstanding that load and using their breath to their advantage to minimize the pressure on the pelvic floor, right? So if with that heavy lifting, their pelvic floor muscle, their abdominal wall, the rest of their body actually has a much bigger reserve to withstand the pressure compared to someone who have never done it. So if someone never done lifting and they go and lift something very heavy at the gym, sure, they can probably hurt themselves. But if they have been training through it, they will be able to maintain that lifting. Some lift till the day they give birth.
Okay.
Yeah.
And that's totally
Yeah.
acceptable.
Yeah, we're debunking that. It's definitely getting better. I feel like pregnancy was getting this rep of like don't do anything, and then women are not prepared for labor because they don't have that stamina and endurance to go through it, and then it's a lot harder for them to recover after. Because where are we getting that strength when you're sleep deprived and you also have to feed the baby? That needs to come from somewhere. So then I think if we can get women exercising, even if they've never done it before, to some capacity, and then we'll just modify it. I always say, if something doesn't feel good, it's not like we have to stop it. Let's change it up so you're still getting the moves within comfort. Maybe we just need to adjust your mechanics. Now, because the diaphragm is all shifted in your rib cage, right, is like tilted up, can we put your rib cage a little bit more down, breathe a little bit more laterally and back to get the diaphragmatic expansion, and then breathing out as you're lifting the load to disperse the forces on the pelvic floor and in the abdominal cavity. There's that in additional fear of diastasis recti, of like the muscles separating to the side. It happens with 100% of the people. Like it's something that your body is supposed to do to accommodate for a growth of the baby. They have to move out of the way. It varies from person to person in terms of how much they move, depending on their structure and also on their genetics. But if they're exercising and working on their abdominal wall strength, that actually helps to strengthen the linea alba that holds the two muscles together to withstand the load and the force rather than just get stretched out like a band. And then, okay, now you want that band to come back to midline. That it's a lot harder for it to do. Then we need to put in more work. So can we do that proactive approach? That would be great. Running too. I have women that they feel great running all throughout pregnancy till like last day. And other women, they're like, you know what, it starts to feel heavy. It doesn't feel great. Even if we make adjustments, they're like, nope, still doesn't feel good. No problem. Like, let's switch it into cycling. Maybe we need to do swimming. So we modify, but I feel the body is never going to be pushed to a point of you're going to collapse. You would have a much like lower threshold of like getting to that state. So what I mean is you would never push yourself beyond that. So if you're not pregnant, you would,
Yes.
because of the pregnancy, physiologically and mechanically, it's just
can't.
no,
It's not possible.
no, exactly. So because of that, we want to get the heart rate going. We want to move the body. We want to have weights incorporated. That helps with the development of the baby and the placenta and gives you that endurance and strength to go through labor, right? And then reconnect with your body. So a lot of my like more elite athletes, I've had one woman that I'm thinking in particular, she was an ultra runner. She started running back at 4 weeks, where often people are not. But her body was prepared for it and she was doing a lot of work and a lot of running leading up to it. So it was then we're at a totally different level in terms of what is your priority and where are we getting back into to then support your body so you are able to do it.
Aside from someone who has been an athlete like their whole life, is it fair to say that they can go back into working out the way they have been after they've
Mhm.
delivered their baby?
Yes, with some of that preparation. So, not jumping straight into it, right? Your body, after labor and delivery, your body is at a new baseline. It's different, it has changed. Now we need to reconnect the pieces, put you back in an optimal place so then you can get back into the gym, running, cycling, doing marathons, swimming, hiking, whatever it is. We want to build a baseline. If we don't, the patterns will stick. So, women that I see in their 50s, they still have that rib cage flare. Like that doesn't go away, or this like forward posture like
Mhm.
this,
Mhm.
even when they stand on one leg, due to the fact that they haven't addressed that in the first place.
Okay.
So it's never too late to address it. And so if we don't, the body can reconfigure itself however it wants, then sometimes symptoms either are going to linger for people or they will reoccur later at some point. So the body is going to give. Like it can't be in a not an optimal place to work for us. It would always compensate because it's lazy in that sense, but it's going to get to a point it's like, you know what? I've been overcompensating for way too long.
Mhm.
So here is something for you. It's more of like a signal. So I try to minimize the fear mongering around symptoms. It's just your body letting you know something is off.
Okay.
Let's deal with it and figure out where it's coming from.
And as long as all that is addressed after having a baby, then they can
Mhm.
go right into working out.
Yes,
Okay.
absolutely. And we incorporate, I started incorporating with the baby, you are doing squats, you are getting down on the floor, you are doing like a deadlift type of movement, you are doing like shoulder presses with baby. Like it's all functional strength. So I preface that because I have people say, I don't go to the gym, I don't have time. I'm like, well,
Use your baby.
technically you're working out like day in and day out. It's there. So let's like maybe work on your breath, engage
Yes.
your core a bit in a functional way. Your muscles will figure themselves out. So I started doing more of that, something that's
Mhm.
more functional and applicable rather than especially if we don't have time to work on the intricacies of like lying down, taking your time to like really connect to your body. It's just sometimes it's not the season. And then once you do have time, let's get back into it and get the body figured out. So yes, you can get back into lifting. I have people that are even stronger than they were pre-pregnancy. Postpartum is a beautiful window for a woman that you can recalibrate. So if they were predisposition to hypertension or diabetes, or other like medical markers that could have been like a little bit wonky, because the body needs to recover from labor and pregnancy changes, and your hormones need to rebalance themselves out, it's actually a beautiful window to improve your health. So, unfortunately, in our society, women are meant to multitask and do everything and take care of themselves. And the fact that recovery takes a year or even longer is just brushed under the rug. And that's not really emphasized. That no, you need time for yourself to work on those things, or just it's okay if you're not because you're very busy and you have a lot going on.
Mhm. Mhm. And let's talk a little bit about movement and breathing, right? When you were talking about, okay, if you're pushing the weight, you're exhaling. Can you expand a little bit on that aspect of lifting and breathing? and the coordination between the two?
Yeah. And it's also very versatile. So my usual go-to is observing their pattern. If they're breath holding, is it affecting and creating a downward pressure through the pelvic floor, or how are they managing, let's say, a weight? So that's a good clue to then help to support whatever breath pattern we need to address. Maybe you're right, we need to alleviate that pressure from the pelvic floor. So I would say, if you, let's say we're doing a squat, breathe in as you go down, breath out as you come up.
Okay.
I start with just something simple just to see how it feels for them. If they're doing very heavy lifting, they may need to hold their breath.
Like the Valsalva
That's
maneuver.
right.
Okay.
That's right. But where is that Valsalva going? Are
Mm.
you holding it and then that pressure is going down into your lower belly, right into the pelvic floor? Maybe we need to cue you to breathe more into your rib cage. So then you have that pressure, but you're still staying nice and strong through your pelvic floor, lower core area, right? So then your muscles can withstand that pressure a lot better than just going downward. So those are my go-to strategies, in a sense of, if we're just doing this lifting, like gentle lifting, if they have had like no symptoms, I would want to have them coordinating with the breath rather than holding their breath to minimize the pressure through. And then if they are doing some heavier lifting and they need to do the Valsalva, then we coordinate where that breath is going.
Making sure they take that breath in before they do the Valsalva maneuver, because
Yes.
I think that's the biggest missing aspect of that type of breathing strategy is, okay, I'm going to do the Valsalva maneuver,
Yeah.
and they hold their breath,
Yeah.
right, without taking that breath in,
Yes. Yeah.
because that intra-abdominal pressure is what's the most important part of the Valsalva maneuver.
Yes, absolutely. Absolutely.
Okay. And this applies to not just pregnant women, but it applies to all athletes. And I've read, I don't know if it's true, but I've read that pelvic floor dysfunction is pretty evident in athletes. Is that something that you see here in Acumamas Wellness?
Less so here, but I have worked with many women who have had pelvic floor dysfunction due to the fact that their activity level is just so high. I'm experiencing symptoms myself as well due to that discoordination with the abdominal pressure. So it's there due to the high load on the pelvic floor, or those breathing patterns of where that like breath hold and pressure down on the pelvic floor. So that is very common. Running as well, depending on the mechanics of the run, that can lead to pelvic floor issues or leaking symptoms. That's a common thing that we see as well. So with that, it's like, okay, are your muscles are just under so much tension that they are not moving as they should with your breath, that we need to incorporate into the mix. That's usually the case, is that the muscles are just really shortened and they don't have that range of motion that they need to catch up to do their work. Sometimes that's all they need. It's like their muscles are likely very strong and they're just not taking their time to put them into recovery mode after they've done so many exercises, whether it's like strength training or like endurance training, because there's just a lot of load on the body. So we do address that.
I'm curious, I don't know
Mhm.
if you have mentioned it, but when you are running, right, we talked about the coordination with weightlifting and breathing, but how do you do that when you're running or when you're jumping, right? Like, is it the breathing aspect that will help with the pelvic floor in that case?
Good question. Yes.
Okay.
A lot of breath holding is happening when
When
people
people
run.
run.
Yes.
Oh.
Yes. Yes. And when they jump. So even we can get them to breathe and
Okay.
observe, how are they breathing? Because I would ask, it's like, are you breathing through your nose? Are you breathing through your mouth? Are you holding your breath? And it's like, well, I must be breathing because I'm
Yes.
running.
Yes.
And then they'll come back, I don't breathe when I run. Just, yes. So it's just seeing what their pattern is. Same thing with the jumping. If they are holding their breath, then I would recommend like you
On the
breathe during
landing, or when do they typically hold their breath when they jump?
on their landing,
Okay.
which creates more pressure. So it's like, can we release the valve when you are landing? So there's that fear, like my muscles won't work. But actually, when you breathe out, right, the muscles come up. So then that would help them do their work a bit better rather than just take that load. With the running too, it's the mechanics. Is the person running very upright? That's a common pattern post pregnancy,
Okay.
due to the rib cage being more elevated, and people
So they're
feel
running like this
yes,
more than their rib
yes.
cage is down and aligned with their
That's
pelvis.
right. That's
Okay.
right. So then that doesn't create an optimal place for the pelvic floor to do their job because you're kind of like here. So
Mhm.
the muscles at the front where the urethra is, they're like, I am trying, but I have a hard time. So just changing the mechanics of having your nose or your tits over your toes, pardon my language, helps them to be more forwards, allowing their body and using their momentum for the legs to catch up. And that helps the pelvic floor muscles to do their job. So we don't always need to like you need to do squeezes while you're running, not necessarily, but if those muscles are just not as strong, like activating quickly, why is that? Often it goes back to that range of motion. If I don't have the range, they have a hard time, like doing a bicep curl. If you're all the way out here, you need a lot more force to lift yourself, to lift that weight up. If you're here, I'm like, I don't have where.
Yeah.
The muscle is not going to contract much. The same thing with the pelvic floor. It needs to have an optimal range to do so then they can do their job. So it's like positioning and then the breathing just really helps. So something very simple like that. But then yes, of course, if we can also coordinate the breathing with the pelvic floor so they have that pattern and coordination working for them so they're aware of it outside of running. So then in running, it can be integrated.
Hmm.
Core strength will come in play too, right? Because that will affect where the pressure is being dispersed to. Same thing with the rest of their body. So it's intricate in that way that we're looking at different pieces, but if we can at least breathe and put a different alignment like when they run, then that helps to improve. Same thing with jumping. I have people that will say do a squat jump, but they're like almost like jumping backwards or do
They're extending
they're
when they're
extending.
in the air. Yeah,
Yeah.
I've seen that before.
Yeah. Or they're doing a jumping jack and same thing. And then they leak in that position, like because they're there. Even if we just get them to lean a bit more forwards, it helps their muscles to catch up.
So simplicity is all we need. Just the basics, positioning, breathing, and you're well on your way. And you're mentioning athletic women. What about athletic men? Do they ever run into pelvic floor dysfunction that you've seen in your profession?
And so, unfortunately, I haven't worked with men, but a lot of my colleagues have, and also men experience pelvic floor dysfunction that are attributed to leaking, same as men, same as women do, discomfort with intercourse or not achieving an erection. If they're constipated, they may be dealing with hemorrhoids or prostate like enlargement that affect how their muscles are working, or they're just holding their breath altogether, or how they're running. So yes, absolutely. I feel men are often just kind of not really included in the pelvic floor realm, and they really should be. And there's that even more of a stigma around that to talk about it more so than women, which I feel like it's a really like a population that's not been helped very
Yeah, and
much.
hopefully we break through that kind of mentality sooner
Yes,
than later, right?
yes,
And
yes.
get guys help when they need it.
Yeah.
Last topic before we end here. As you know, I'm a respiratory therapist
Mhm.
and I work in the pulmonary function lab, and I come across a lot of chronic coughing patients. And chronic coughing can happen, very minimally, or it can happen with forces, an expulsion of air from the lungs and the contraction of the abdomen and the intercostal muscles. And that for sure puts pressure on the pelvic floor. Is there a specific way that people should cough to help protect the pelvic floor?
Hmm. That is a great question. And it's something that I'm like trying to work on and incorporate to see can we change someone's habit of how they're coughing. One thing I found is can we get the cough out more into the rib cage through the side? So expanding the like the lateral part of the rib cage instead of creating a downward pressure? Or do we need to work more on like the pelvic floor support? Like, do we need to do a bit of like a pelvic floor contraction to engage the lower part of the core system, so when they're coughing, there's less pressure going down? So that is often when we incorporate what it's called the NAC, is the pelvic floor squeeze to minimize pressure. Then there's less shifting of the organs, I find. So from doing internal exams, when they cough, there's like the organs, excuse me, are really shifting down versus we doing a bit of a contraction, there's less movement through. So
Okay.
that's often a strategy that I suggest. Now, just changing the mechanics of like coughing a little bit more up, rather than down, that's really tough. It's something that a person really needs to be aware of. I've had some clients that tried, they have a hard time with it. So then we work on, okay, can we then work on expanding your rib cage a bit more so you have more mobility? So when you're coughing, it's not just a straight downward pressure, so a bit of a disbursement of pressure. And if we do notice that there's quite a shift of the organs, then can we do a pelvic floor squeeze? It doesn't, from the literature, that NAC is not going to make the muscles start activating automatically. It's something that they may need to do on like a long-term basis to support their pelvic floor. Because you're right, with chronic coughing, that's a constant pressure down. That can actually lead to pelvic organ prolapse. Same thing, some professions like chiropractors. I've had a person come in that they had a prolapse, but they've never had any children, and that was more evident to them in their 50s because they were doing a lot of adjustments and breath holding. Yeah. So I can imagine too, in other jobs where there's just a big load on the pelvic floor, that can lead to, over time, the ligaments not being able to withhold the pressure, and then they lengthen, and then a pelvic like organ prolapse can occur. So think too, just thinking of the mechanics. So if I'm coughing and I'm trying to expel something from my lungs, if we have a better pelvic floor and abdominal wall support, can we use that out by lifting everything up rather than creating that downward pressure too? So then you're creating that force and activation through the muscles from the bottom up to expectorate.
So would it be the breath in or the breath out that's encouraged before the cough?
I guess a breath in and then
Yeah.
out.
Yeah. And I guess that's the natural reflex our body does anyways.
Yes, that's right. But
Right.
it's interesting when you see people cough, then their abdomen is relaxed and it's like, and their whole belly is expanding when they're doing that, or when they're laughing as well, rather than laughing and then activating the muscles.
Yeah.
So that's something that
I
I've
didn't
been
think about
noticing.
laughing.
Hmm.
Yeah. Well, that brings us to the end of this episode. It was fun. I've learned so much. And yeah, this wouldn't have been possible without your participation. Thank you.
It's teamwork. It's been so fun. It's been
And
great. Thank you.
the biggest advantage of the OptiBreathe show is I get to learn from experts like you and then share this with the world.
Yes, love that. Love
Yeah.
collaborating.
Well, thank you so much, Maria.
Thank you. Thank you
All
for
right.
having me.
If you're in the Vancouver area and you are looking for guidance on pelvic floor health, be sure to visit Maria here at Acumamas Wellness. And remember, the goal of this channel is to create awareness around respiratory wellness, and your participation is what gets us there. If you liked this episode today and would like to see more on everything and everything about breathing, don't forget to like, subscribe, share, and hit the bell for notifications on our next episode. Until then, inspire to respire.